Hello. Yesterday I talked about heart rate variability being one of the key 5 health indicators that I suggested you track between now and the end of the year. Now, heart rate variability is actually the variation in time between each heartbeat, and slightly counterintuitively, more variation is better. A rigid metronome type heartbeat is a signal that your nervous system is under strain. High heart rate variability, that means your body is recovering well and adapting to stress effectively, i.e., your body is working really well, and whatever stress you're under, you are managing. A low or declining heart rate variability, well, that's really an early warning signal for you. And often, and this is one of the reasons why I'm suggesting you start to track these numbers, often this will show up in the numbers before you actually feel it physically. Why do I think this matters for you, the people that are out there watching this video? Well, heart rate variability also predicts things like our quality of our decision making, our emotional regulation, i.e., staying calm in high pressure situations, and our cognitive performance. Those are all key things that we need to be on our A game on most of the time, don't we, in order to manage our businesses, our departments, our teams effectively. And there is a clear connection between heart rate variability and sleep, because poor sleep is one of the fastest ways to negatively impact your heart rate variability. One bad night will genuinely show up in your stats the next day. Now, other things that will affect it would be things like overtraining, alcohol, high stress, and of course periods of illness. That's all times when your body is under pressure, and they will show up in your stats. The good news is that we can positively impact this number. Things like good sleep, constant exercise, stress management, and reducing alcohol levels, they will all help to improve your heart rate variability. Now, as with most things, you shouldn't stress over daily numbers, but you do need the numbers daily so that you can look for trends over time. And if you're matching those trends with things that are going on at work or in your private life, you will probably start to see a correlation between high pressure at work, and you'll start to see that variability go in the wrong direction. But that's good, because then you can take positive action and do something about it. Now, most wearable health devices measure it. Whoop, Garmin, Apple Watch, Aura rings, they will all measure that. So you will have those stats, I'm sure, somewhere that you can start to have a look at them. So my challenge for you today is to look at your stats, establish your baseline, and then track it over time and watch it improve as you take positive action around your health. Have a great day.